Good.
Okay.
Thank you for joining us for this interview today, Dr. Aywak. It's a pleasure to have you with us. It's a pleasure to learn from your journey and to just see how we can shape the future of practice and the future of the profession in the country and the world over. So the Footprint Project is basically about sharing your stories, collecting them, and making them accessible to young professionals so that they can learn from you and they can see what career pathways and career opportunities are out there for them to explore. So as we're getting started, maybe let us know who is Dr. Aywak, Dorothy.
Okay, thank you, David, and even for this opportunity to just share my experience and my work life. So Dorothy is a firstborn, family of 6 children, born and bred in Nairobi, schooled here and working here. I'm also a mother of 2. And when you don't find me working, I'll probably be engaged with somebody within my family or my friends' network.
Great. So you are the family person and the social friendships.
Yes. Yeah.
It definitely helps a lot. It gets you off the struggle of the rat race, running every day to work and everything. So working in Nairobi, where do you practice and how does that look like for you?
Okay, so currently, actually for the last about 18 years, I've been working at the Kenyatta National Hospital. But I started my work journey rather after internship. My first posting was to more or less like an industry setting. I was working in a place called the National Eye Drop Production Unit. So for about a year and a half, I used to produce eye drops that would basically be availed to faith-based and government hospitals. So that was my plunge into pharmacy career. But in 2005, I joined Kenyatta, and it has actually been an exciting experience. I've worked through different roles. Kenyatta, we have several different pharmacies, all catering to different users, clinical users. So I've worked, I think, practically in almost all of them. Outpatient setting, I've worked in the pediatric. My longest stay was actually in the pediatric pharmacy, in our main pharmacy. So I've worked across the various pharmacies. And then I've also held other leadership positions. And so currently I'm the head of unit for pharmacovigilance, poison and drug information. Last year I had to balance 2 roles, a role in pharmacy and one in our comprehensive care center. So that had been quite a challenging year, but I'm enjoying what I'm doing now in the area of PV, poison and drug information.
Oh, great. That's amazing. And maybe just a follow-up to that feedback that you've shared as well. How was the transition from the eye drop production unit and into the to the KNH? But also another thing is, was this eye drop manufacturing facility a government initiative and how did it come to an end?
Yes, it's actually a government partnership. I'll just call it NEPU, the National Eye Drop Production Unit. It's housed at the Kenya Society for the Blind, and it was a partnership with the Ministry of Health to be able to at least make sure that we have eye drops available across the various facilities. So particularly government and faith-based. And then some of them are products that we probably would not get in mass because our countries, if you look at the volumes our country can request for, would be very small. So it had the ministry had partnered with the Kenya Society for the Blind to have that facility within their premises. And it was a rotation. It was actually the first time they had seen a pharmacist posted in the area. They've been having one pharmaceutical technologist, running the unit. So it was actually quite interesting trying to apply what we learned in pharmaceutics. There are some things which just seemed very theoretical until the point when I actually had to do production and understand the concept of aseptic technique, sterility, and also trying to get those who have been doing. You see, I found the industry already there. So trying to explain to them the importance of sterility, why would want to clean a bit more frequently than they were used to. They would see this is a new person who has just come fresh from school the other day and is trying to claim to show them how work is done. But I think it was a good opportunity to even just get the unit to formalize a lot of what we're doing. Because by the time I left, we had written down SOPs. So how to do the work, as opposed to just looking at a formula and just to koroga the dawa, So having standard SOPs and just getting to that process. But I left before we went further than the SOPs. And I would hope that at some point they'll get some other younger pharmacists to join the same team and just start something new. But my experience there taught me that, even when you're fresh from school, even when you're young, you start thinking that there's nothing you can contribute to make better in a facility, especially when you find people who have been there for ages and they have a way of doing things. So I find, and it's just the way you communicate a new way of doing things. Then I learned the 21-day rule, that when you're introducing something for the first time, just expect that there'll be 21 days of resistance. After that, if you keep on being consistent, you find people adopt it. So that we just encourage. You might have a good idea and you wonder why no one is speaking it, but give it time. Because sometimes people actually want to see how this change is going to affect them before they join the bandwagon. So moving to Kenyatta, it felt a little different because I've been used to, formulating medication. Where I didn't have to come up with any new formulas, but I've been used to just formulation. And now this is a different side where you're dealing with the patients, the standard dispensing. And that in Kenyatta, and we had a few, and some of those who were ahead of me, a little bit in campus, and now Dr. Mutu of Gatis. So that was coming up. And so it was an interesting change. It was something interesting, new to being able to interact now, bedside, the pharmacist bedside, but it still had a lot that you'd still be able to engage, even at the pharmacy level, being able to give drug information, being able to, just see what little you can contribute to patient care. I remember I was in the pediatric pharmacy for the longest time. So I made it a point that if the ward that I used to attend 2 wards, that when it's during the discharge, I go and sit with the registrar, and then now when they're doing the discharge prescription, actually check what the discharge goes to with what is available, so that it's a lot easier for the patients. You see, there's not a lot of back and forth. So it was a good change. But I think as a person, over time I've learned that you need to have is it a spirit or an element of being flexible, just being able to adjust to your surroundings, being so that you're not so rigid that this is the only way I know how to do work and I cannot move from there, but also just agree that situations change, environments change, and you need to go with the flow, not peer pressure, but go adapt to the situation that you're in.
Adaptability, very critical, I think. Yeah. And thank you for that. And then I think in a way you applied your compounding skills from the National Eye Drop Production Unit into Kenyatta in the pediatric, because for the time that I did my internship at the facility, there's a lot of compounding for the pediatric population, especially. And therefore that skill is still transferable in the sense that you had worked there and you're able to still continue that. That's an interesting bit. So working within being the head of unit in Kenyatta National Hospital for drug and pharmacovigilance and drug poison and all that, how does that work for you? And what are the key contributions that you feel as pharmacists we can apply in that particular line of work?
Okay, so currently the role involves we have the medication safety services. So now a lot of PV, pharmacovigilance, what is known there, the patient safety. So I've learned to, because at the moment we are strained in terms of staff numbers. So I've learned to rely on building networks with those who are doing similar related activities. So I work closely with that department. We have the healthcare quality and safety. So that we see what patient safety strategies we can work on, activities we can work on together. And that way we can be able to get a lot done. So in terms of monitoring, adverse drug reaction, APHIS, like when we had the COVID vaccine, that's the adverse events following immunization, looking very closely at medication errors and trying to encourage the identification, the reporting, so that we can put systems in place to make things better. And now what is new, a new service, or rather we are reawakening the service, is the Drug and Poison Information Center. So that now it's a facility where through a toll-free line, you can have the general public or even healthcare workers call in if they have any cases of poisoning. It has been mainly marketed with pesticide poisoning, but any case of poisoning, and then you can be able to get guidance on how to do the immediate management as you refer the patient to a facility. So that's the dream we have of having that rollout everywhere and even just build mini, hoping that at some point we'll have even other mini centers in other facilities, so that when see this rider, every time when drug is advertised, that in case you have a question, call your pharmacist or call the doctor. So this call the doctor, call the pharmacist, usually it's just left hanging there. So who do you actually call? So let's just bridge that gap and provide where, if we are saying call, where do you actually call? Because maybe somebody has gone to a community pharmacy, they're not seeing themselves going back there. So what is the solution? So I envision it as that solution to, in case of any inquiries, call your doctor, call your pharmacist. That is what I envision for for the center. But for young pharmacists, and like them to just, even in a small way, now you start a dream, a big dream, but you try and narrow it down. What is practical, an actual step you can do? Can you make yourself familiar with what products you have? And what is the best way to use them? See, sometimes if I give an example, like the eye drops, I don't know how many people actually explain to patients how to open the eye drops. Because you see the tendency, they say, other than bread, the next difficult thing to open is medicine. See, the medicine bottle or the eye drop. So now sometimes the way, if we don't do the right counseling, somebody introduces a microbe to their product, and then now you start, yes. So you see, we have opportunities everywhere, and that simple instruction you give to a patient, you might think that it's something very tiny, but you've made quite a big difference, because you notice people keep medicine that they don't know how to use. Or yes, so we actually we are not encouraging promoting good health, but we can have a different way of promoting good health by just giving the right advice and providing that facility for giving the right advice. I hope that answers your question. But I usually think the big dream, this is what we see in the West, the big dream, maybe you're thinking you'll have ambulance and send an ambulance somewhere, but start small. Small is, let me advise the patient correctly, who needs reassurance, can I be able to liaise them with a emergency facility and brief them what to expect? How do you make work easier across the healthcare chain?
And I agree with you. And in a way, when you talk about the National Drug Poison Information Center, even in terms of that eye drop that a patient is using, when they introduce microbes, it stops being medication. It's kind of actually a poison to them. So therefore, you as the pharmacy should be able to do that and help them get the best outcome from that product. And the other thing that you've mentioned that I think is very fantastic and very interesting that we need to adopt is whatever it is that we're doing, and that is one thing that I would really be glad to engage with you and see how can we move that forward in terms of establishing the Drug Information Center, Poisons Information Center, and it's that concept that can be taken across all the other domains, because we have advertisements, we have communication about products, but after you've sensitized somebody, they have the information. Where do I get care? It is the same way we are having about when you feel like you have symptoms of COVID-19, go to the nearest hospital. Which one? Call the emergency call center, call the ambulance. You call the ambulance, it doesn't come. And this was based actually on an experience that I had during the COVID period, during my internship period. I had a COVID scare, and I experienced the symptoms for like a week or two. During that period, I was calling the ambulance number. Nobody was answering. When the last time they answered, I was being told, go to the nearest hospital for tests and everything, which means I'm still going to use the public means. I'm using the public means, I'm going to the facility. If I was positive in that chain of care, I'm exposing all the other people, including the passengers that I was with in that particular matatu. How do we contain such? And I think that kind of follow through, what is the action, referral to care pathway, needs to be integrated. And I think from an information center, that would be an amazing investment. And I'd be glad to see how that works forward as well. Yeah. Then just to go back to the pharmacovigilance bit, as a country, and maybe from the work that you're leading within Kenyatta National Hospital, do we have a pharmacovigilance information center repository, kind of? Because there are so many things that are being reported, but are we consolidating them that we're able to actually establish cases for the regulatory agencies to drive action on that front?
Yes, I would say we do have. The Pharmacy and Poisons Board is actually charged with that responsibility of being able to collect all the data and analyze and be able to give reports and also identify signals and communicate them to healthcare workers. And they're doing quite a lot of good work around that, sensitizing. So we just need to be able to support in terms of being able to utilize the tools that they have shared, like now the electronic PVRS system, the Pharmacovigilance electronic reporting system. See, if we encourage those who are around us, the healthcare facilities, and even there's an option for even the public to make their reports through their mobile PV system, because it's just a number, a code on the phone, and they can make the simplified reports, and they can even the general public can access the electronic system, and there's a simple way for general public to report. And all this information does get to the board. I know they would be challenged in terms of personnel to be able to synthesize all this at a go, the same time as they are trying to also build systems and sensitize staff. So, but they do the same. They do it. They are able to, when you log on, like we have the county focal pharmacovigilance persons. So you'll be able to, they are working on you being able to access what is happening in your county, so that you can be able to help the board also respond faster. Because remember, we can work together. At the national level, they identify the signals, and then those on the ground can be able to see how do we work faster to be able to respond. So I believe we do have that with the Pharmacy and Poisons Board, the vigilance, the pharmacovigilance department.
Okay, that's great. That's great. And I think it's upon us now to see how do we strengthen and how do we support it.
Yes.
And the basis as to which I was asking that is we also see there are a lot of community outreach programs, medical camps and all. But the question is, who is capturing any patient complaint that might be associated with safety signals and safety-related concerns? How do we report that? And how do we get pharmacies to actually be an integral component of that patient outreach programs from a pharmacovigilance standpoint? Because in the recent past, I saw the directive by the KMPDB, Kenya Medical Practitioner Dentist Board, that for every medical camp or medical outreach, there has to be a medical doctor or a qualified physician to ensure that the diagnosis, the prescriptions that are being generated are by qualified professionals. And it means then even the handling of the medicines, who is doing that? And I think those components could be integrated and driven forward. So yeah, thank you for that. And I think as we move along, we see just what possibilities are out there for more of the pharmacists and more professionals in their different areas of work. Yeah. So as a follow-up again, maybe just to, what does your typical day look like? When do you get to work? How do you do your things? When do you clock out?
Sometimes I feel like I don't exactly have typical days, because I start, I start with my usual personal routine, which is if I can get to go to the gym in the morning, I do that. But when I get to work, a standard day would be 8 to 5, but occasionally we have 7 a.m. meetings. So a lot of my days are filled with maybe morning meetings, because I'm also involved in various other hospital committees. I mean, that microbial stewardship committee, the medicine and therapeutic committee secretariat. So you might have a meeting along that line. There's a budget committee, training committee. So I'm sure since you had the experience of being in Kenyatta, we say if there's one thing you're sure of when you go up in management is that meetings seem to be like the routine of the day. But besides that, I also look at, because as I mentioned, it's a new, the creation of the units is new. I think we are like 2 years old. So just looking at the tools, one of the things that I've been keen on these days is spend time to look at the tools and see what is making it difficult in adapting tools. So I've been looking and reviewing at the tools that we are using, trying to also troubleshoot where an area maybe does not have a mechanism of reporting, working with the team leader or the in charge in that area to be able to report. A lot of following up of issues that have been raised, see if there's a product related issue, trying to follow up to the end. Then because I'm also involved in procurement, so that trying to make sure if there are, when there are orders that need to be processed. So I have that's also taking up quite a bit of time. Then I'm passionate about training and mentoring. So there are a few who I would say I have under my wing, who sometimes may find that that's the time in a day, depending on availability, the time you get to sit with somebody and just talk about different issues related to, most of the time, the profession or otherwise. And reports reports and minutes. A lot of time is spent either writing minutes, completing a report, preparing for a meeting, just summarizing. You just find before you know it, it's end of a month, you have a monthly report or a quarterly report, or there's an activity that you have to prepare for, maybe an audit. So just getting things in place for an audit. So I cannot quite, I'm really looking forward to the day when I say I have a typical day that I know today I will come and maybe handle. Yes, I know if it is outpatient pharmacy, I'm just going to work with the patients who are in a certain clinic and they go home. So I don't exactly have a typical day. But like I said, I have learned over time to be flexible. Yes, because realize when you're very rigid, it's very hard to get work done, and then you can end up being quite resentful because you feel like people are just throwing things on your desk that you had not planned for. So I've learned to be flexible and see, okay, so what needs to be done? But I always start with a to-do. I always have, I had a previous boss who used to laugh at my to-do list of 16 items. And then if I just get to do 3, becomes a challenge. So these days I've been having, I call it brain dump, right? All the things that I plan to do, but pick the top 3 and try to finish the day with those, at least make sure those top 3 are done. Yes. So that out troubleshooting, minutes, report writing, data collection, troubleshooting system. Yeah, that is my typical day.
I can imagine. It's a lot of work, but that is what comes with responsibility, because the higher you grow in your profession, there's more responsibility, and people are counting on you ultimately. So you have to be there to deliver on that mission. And I love the bit that unless you get used to that adaptability and moving along with what comes your way, you'll get frustrated. It'll be like, these people don't care about me anymore. So
yes,
get adaptable over time. That's amazing. Thank you. So actually, one of the key things that I just want to commend you about is the aspect of mentorship, because I was part of the team that worked under you within Kenyatta. And I know which is preempting the next question that I'm getting into, the additional things you do beyond working at Kenyatta National Hospital. You still serve as the secretary HOPAC. And one thing that is amazing that you're doing is you're exposing most of our young pharmacists, especially those who work with you, who collaborate with you, to take roles within their society and just to help see what possibilities are out there and to strengthen the association as well. So thank you for that. But then for me, the question would be, what is the motivation behind you engaging in HOPAC and doing the work you're doing with HOPAC, but also getting more young people into under your wings just to grow them?
Okay. I have to say, actually, the person who first introduced me to, I'd heard about HOPAC, the way you just hear the meetings and the like. So I think my first engagement with them was the 2010, the time when, and the one who is now my current boss, the director of pharmacy, Dr. Birichi, was the first person to actually tell me, now let's go for a meeting. Planning it was the 7th annual, planning the 7th annual symposium at that time. So that was my very first, it's interesting, he's now my current boss, the very first person who got me to attend a planning meeting for HOPAC event. And it's just that being able to, being able to be pulled along the meeting, because I was not as consistent. Even I think I would attend the symposium and then that's it. Attend maybe a workshop or a CME and, not be engaged besides that. But when he pulled me along to a meeting and worked with the planning team, that being able to interact with those from other facilities, because we can't work everywhere. But when you're in a team and people are from different facilities, you get an understanding of how work is done in different areas, or even just appreciating the challenges that different segments have. Like public sector, and in the committees we are a mixed public, faith-based, private sector. Just being able to appreciate how work is different there and practice is different there, and some things that we can borrow. And the thing that I like the most, that it made even working in public sector easy, because you see, when you already have a relationship, a personal relationship with someone from private sector, it's easy to call them, even when you want to. We used to do a lot of borrowing early on. So when you want to borrow medicine, you know who to call. You go even ask, who do we think will give you the best price? So it narrows down your work. So instead of calling 10, 20 suppliers to figure out where you get an item, I called my colleague in Aga Khan and asked them, do you have this product? Where did you get it from? Then, it makes decisions a lot faster. especially when you're in this, like for facilities from, I know companies, you will not work over the weekend. So when it comes to a weekend, the people who sort you is when you talk to your colleagues in there. So that's being able to have that personal relation. So you don't have to, you're not calling a hospital and you don't know who you're talking to, but you will work through those angles, and even just being able to make things easy, even from, if I think of a few friends who I've met from the ministry, when they have a program, there's a challenge penetrating, being able to understand who do we get to on board so that we can, when we have a new program. And so it made it easy. You start from a cup of tea. You're talking, engaging, and then you find, okay, I think I have a solution to your problem. So that network of being able to find people who can help you think through a difficulty or solve a problem, or even just think about delivering a service or an activity better. That for me was good. And then just learning how to do things different. Then I found, because he pulled me to a meeting, there's no other way I would have learned if somebody didn't take me there and tell me this is how things happen. Because there are some things it's difficult to learn, like maybe in a classroom. You sit in a classroom and say, this is how you organize an event. Some things someone just needs to work with you. There's no way in it. So I really appreciate Dr. Birichi for that, because he actually is the one who pulled me into a meeting of HOPAC. And from there, I just plugged in, and I have really enjoyed myself in HOPAC. And I would also want the same experience for others, because people don't know, they may not know, how do I start? So I keep on, every year, I keep on hoping that I can get somebody new to bring along. And then something that, you see, not everyone will want to stay, we just celebrated 20 years of HOPAC. So I appreciate that the person who was there in the first year might not be there in the 5th or the 10th or the 15th, but at least somebody has passed. And even if they can go and do something similar, like in the field, I would be very excited if we have many other varieties, like I think community pharmacy is coming up. If we have various cohorts or various specialization within pharmacy, and when I'm talking about specializing, I'm not looking at it like only pediatrics or internal medicine. I'm looking at it like community pharmacy, regulatory affairs. If you can be able to have, because there's something about a unique group of people that you may not, only the people who speak the same language as you would understand the needs that you have. Then you can grow in that field and build your numbers and and even advocate for others to join that space. As opposed to when we only look at pharmacy as just being only one avenue. And everyone is in it. Let's have the one home where everyone is in it, but let's also encourage people to diversify as much as possible and just get into areas that we had not thought. So I'm actually even excited with what you're doing with regulatory affairs, because you see, most of the time you'll find even those who are in regulatory affairs, they did a lot of on the job. But what you're doing with engaging them and just giving an exposure, this is what regulatory affairs looks like. It opens the eyes and makes other people think, okay, I can actually delve into this field. And before you know it, you have multiplied the number of people in that field. And for me, the dream would be seeing, like we see regulatory pharmacies coming up and saying, this is how we are growing as people with the same, as a profession. The community pharmacy, if they could also do the same, and I think they're doing the same.
They're starting young.
Grow, and you get to a point where not every community pharmacy looks the same. If you can say this one, if I go to a certain one, I know they are specialized in skincare. So if I have skincare issues, because there's a place where I can go. If you want weight control management by a professional who can tell you, there's a lot of in social media, you see there are a lot of groups who are trying to peddle different products. If I know there's a pharmacy that can tell you, this is how I can effectively manage my weight, this is the medication I'm taking. If I need to go on supplementation, these are the right ones. Somebody's going to be monitoring. I can actually call and tell them I have a problem with one thing. If it's a geriatric medicine, a number of us are buying medicines for our either our parents or caregivers or guardians, the like. If I knew there's a place I would go, and these people are very good in geriatric pharmacy. So I would hope that, yes, I would really hope that is where I would be seeing, as opposed to, just sticking in a box and saying, okay, hospital, there's only one way you envision hospital, only one way you envision community. So just growing, like say, life is better when it's in color.
Yeah.
So if you have multiple cohorts of different ways of expressing pharmacy, I think it will make the profession colorful and beautiful, as opposed to looking at that there are only two ways you can be. You're either in industry or in hospital,
No.
Yes. Yeah.
And I agree with you with that, in the sense that even when we are coming in the different specializations where we are, by being so good at all the spaces where we are working, when we come into the mother house PSK, we're able to see the new ideas based on the challenges,
Yes.
opportunities, and what frontiers we're envisioning for the industry. But if you are all just in a linear line of work and thinking the same way, there's no diversity in thinking, there's no diversity in perspectives and solutions, which means the development will also be curtailed in a way that there might not be as much as we are hoped for. So I think that is a good bit that we need to explore. And I'm glad that you already started it from HOPAC. The community pharmacy group have already started their engagements. And the only thing we can do is to support and also to share our perspectives. How do you do it better? How do you get people to move forward with you? What are the key things? Because one of the bits that I've noted, and this is just personal experience perspective, is we wait so much for people to approve what we want to do, and that is affecting us as young people. When the longer you're waiting, and the way you've said you need 21 days rule, try it every other time, so that for the 21 days, there's definitely somebody who will buy into the idea. But our challenge is we pitch an idea today. I want you to take it up. If you don't take it up, I feel like it's not feasible, then I stop it at that time. It will never see the light of day. When it doesn't see the light of day, somebody who might have benefited 2-3 years down the line will never have the opportunity to benefit because you gave up too early. And that is a challenge that we are contending with, but I'm hoping it changes as we move along. Yeah. So thank you for that. So maybe what I could go into in terms of, you've talked about Dr. Birishi being a key force in terms of getting into HOPAC. What are some of the key enablers in your professional journey? What has helped you be where you are? And how can some of us also replicate some of the same?
I have to say, okay, besides my immediate boss, I also have had other pharmacists who have either been my supervisors or my bosses at different times, who have also shaped and made it possible for me to work the way I do. Like I say, early on in industry, I had Dr. Sarah Bugigi as my supervisor, and she was very strict and procedural. And for those who wanted to take off, use that industry experience to do their own thing. For me, I learned a lot about having structures and procedure and just being focused and being dependable. That's a lot of what I learned, that you need to be dependable, you need to be focused, and you need to provide structure. So I really like that from hand. It has helped me, like when I feel like life's challenges, just being able to go back and fix in a structure and just think, what is the routine, get a habit, get a track, a routine that you can work with. And then you move along that, a standard, establishing a standard. So I learned a lot from Dr. Bugigi on that. Then I've had other bosses like Dr. Tom Menge. He was, when I joined HOPAC for the very first time, in fact, he encouraged me to actually apply to vie for an elective post, because what initially all the leaders, the national office bearers, were chief pharmacists of the various facilities. So chief pharmacies either Nairobi Hospital, Aga Khan, so they're all chief. So the first time when I told him I have an interest in vying, but I'm not too sure because I'm not chief, I'm not head of a department, I think I was still just a senior pharmacist. So I was thinking, I'm not chief of anything, I'm just heading one pharmacy. Can I really go for this? But yes, can I go for this? Because I feel the calling, I feel the passion. I am really excited and would really like to work with the rest of the bosses. I would say the bosses of HOPAC at that time, to be able to actually bring these best standards home, as in just bring it, especially in public sector, so that we feel the same vibe as private sector. So he told me, go ahead. And many things when I had like second guess myself is very good in, if you feel, like a calling or you feel a passion for something, just go ahead. So I really liked that. So he drove me to that, to venture in actually entering the national office, and have been there since, I think, 2014 or 15 there. First as a committee member before now eventually vying as a secretary.
Mm-hmm.
And then there's also there's the standards and the passion that is now Brigadier Dr. Ismail Aule has. And he was actually a keynote speaker at just a recently concluded conference. There's a passion he has of how things can get better. Don't get stuck with that we have arrived. He has this, he inspires you to not feel like you have arrived. That when you've achieved that one thing that you wanted to start, now take it a notch higher. So that's something that I learned from him, and just being able, even if I would be stuck at something and wondering whether it's something to really push ahead, if I manage to, and he's call and ask for his guidance on a matter, so that now you don't get comfortable. You don't get comfortable with just doing just enough, just barely getting by. So I like that he inspired that. The others who over time, have pushed me, either workmates have pushed me, encouraged me to just, do more, be more. And and even sometimes I actually get inspired by even not necessarily those who are older than me, but some of the younger interns. That's why can't we, we're used to writing things on papers. Why can't we make it a standard tool? And they come up with a standard tool. Or even just tweaking how we communicate. Like I really liked the campaign when we were doing the Eldoret conference last year.
Yes.
They're using social media. Now for the rest of us, once you've hit Facebook and liked something, that's it. You move ahead. You have done your contribution, but just being able to explore new apps, new ways of communicating, because you realize not everybody talks like we do. Not everybody is of letters like us. People are of memes and short. You see, the generation has So I have a point. I say it's reverse mentorship. I learn from those who are ahead of me, but I also make a point of learning something new from those who are like yourself, an intern in Kenyatta. So there's a few things I pick from here and think, okay, we can have turns always in a group. And I think it's when you are an intern, in the internet, but it's when you're an started this process of when we do a CME, do it in combination with an intern. Give them an opportunity to also present, so that at least when they go to their facility, that will not be when they are posted somewhere or they are working, that will not be the very first time they are talking to an audience. They have had like practice. So yeah. So I've learned a lot from those who are older than me, who have been in the profession longer, but also make a point to pick something from even those who are behind me. There's a way they see things and I have not seen them this, and it makes work easier. So just being able to be open and say adaptable. This life, I think you will not go anywhere if you're rigid. You just have to learn to be flexible.
Great, that's amazing. And I love the fact that people are changing. Recently I also felt like I was getting older, because people are creating new digital content, especially for the football club that we are part of, Dawa FC. And the way they are coming, even with the stickers that have our own faces. I've never done such a thing. I've never even used those that are standard, but somebody is able to do it. So it's amazing that people are having those capabilities. We learn from them and we get better along the journey. So what are some of the challenges that Dr. Aywak you've dealt with in your life, professional life, and in your life generally? And how did you overcome them?
I'd say challenges professionally, I've had also worked under very difficult, sometimes we can say difficult bosses or tough bosses. And so just being able to deliver work when the environment is toxic has been, I would say, would be the most challenge. So the greatest challenge I fear is usually toxic environment, because like I say, we are not all the same. So we are not all brought up the same. And even if you're from the same home, we all behave differently. So toxic work environments have been my greatest challenge. So it's just a matter of trying to figure out, how do you diffuse situations? How do you learn to work even when the weather is cloudy and stormy? So what is the weather that you're brought to work that day? So sometimes you have come, yes, you're the one with the all sunny weather, but the ones who are around you are gloomy, but you still need to get the work done. So that would be, yes. Professionally, I would say I would struggle more with when you have to work when there's a lot of negativity around you. Yeah. Personally, I've also had those who within the family have various health challenges, and then now just being able to deliver your work when you're dealing with that kind of of burden ends up putting a strain, because you're also working with the back of the mind where you are carrying a burden that is usually, you sometimes you can't dissociate yourself as much from the challenges that you face personally. So, but I have learned to just, take things a day at a time. Been reading quite a lot of books with the habits, Atomic Habits, Tiny Habits now with the BJ Fogg, and just learning sometimes you just need small changes, just small adjustments to your routine to help you cope. So that's what I keep doing. Just make small changes, and even just being able to celebrate small steps. So that yes, that makes for me that helps me get through a lot. So when I'm faced with a negative environment, you see, you can sit down and wallow in misery. Or you can say, okay, fine, you try and you think there's this story used to be told as student, the donkey that fell in a hole and someone was just throwing soil over it. So at some point decided, instead of complaining, to shake off and step on it, shake off, and eventually all that, they ended up, the donkey was able to jump out of the hole. So that's, yes, that's the attitude I prefer to carry, that yes, sometimes you cannot run away from negativity, but if you can find a way to shake it off and step over it. Yeah. So it is not, it's not as simple as the story, but sometimes you just, with time, you build character, you build resilience. There's a friend who was asking me, what is my word for the year? So this year, I think my word for the year is resilience. That just being able to bounce back when you have situation, and also getting opportunities, because for you to effectively bounce back, you also need to have enough rest. Get opportunity for self-care, because we tend to be caregivers, and people assume that you're supposed to be superhuman, take anything, nothing should faze you. So also being very intentional about self-care, that's something that I'm very keen on. So building resilience and being very focused about self-care.
Fantastic. Thank you so much for that. It's a very interesting perspective. We need to take care of ourselves. As a caregiver, you also need care. Yes. Without which you'll break down. Yeah. So looking at your professional journey and the kind of work that you've done all along, if you had an opportunity to change one thing, what would that be?
I probably would have formalized mentorship relationship earlier, because my engagement was not like, even all those who had mentioned as people who enabled me or mentored me or grew me, there was no formal way that, yes, we are sitting and this is something that I want to grow in. It was just interactions, that when you're interacting, you learn something and you grow from there. So I would have probably had a formal mentorship kind of journey, so that now I actually can track progress. I can actually see, this is where I am and this is where I want to go, and somebody helps me along that way, because there's a benefit of somebody who's been there earlier, who's there ahead. Because myself at that young age, I would have to know, okay, this is how you communicate to a certain population. You see, now, like my age group, I know there's a YPG, the young pharmacist, and I guess they assume either us, we are old, or the middle-aged, I don't know. But now, this just being able to understand at different levels, people communicate differently, and appreciating that if you want to drive a point home, how do you communicate it best? So I would have appreciated, if I think I would have gotten into a formal mentorship relationship earlier, I think it would have helped me. But I say it's okay. There's nothing like time wasted. You just pick up from where you are and move ahead. So I'm more keen on that. On if I find somebody who I think can grow, just being able to take some time and learn. And sometimes, you may not be with somebody who they can say it, they'll spend 3 months taking you through something. But appreciating that the little time I can have with somebody who I feel I can learn something from, to make the most of it. In the recent conference we had Dr. Lucy Muturi ask that, have you met somebody new? And have you actually found something else? Because that could be just a person who could unlock something new for you in a different arena. So so I just thought, okay, I should have actually earlier on, if I got that message much earlier on, maybe I'd have been further, but I don't regret where I am now, because at least I know I'm not static. So I have grown. May not have been a leap, but I have grown.
Exactly. And by the virtue that you've noticed what you needed at that time, it means you'll now do better. And probably people who are going to watch this video today will be able to learn from you and also see how they can make the journey better for themselves, which is an investment and a good growth opportunity for them as well. Yeah, thank you for that. So what are your priorities and current focus areas as a person?
Well, I have been saying that I'll prioritize doing a PhD, but I'm thinking that it might be permanent head damage and not really translate to much. But so I'm really looking at, I want to grow and to grow in a way that I am not narrowed down to I want to grow, but grow in a way that allows me to work in diverse situations, diverse circumstances. That's, I think, diverse settings. Yes. So I would say my priority is just find this thing, this learning opportunity. So learning is a priority for me right now. This learning opportunity that allows me to work in different, in a diverse environments or settings. So I have not yet figured out what is this one thing, but that is diversity is something that I'm quite keen on and growing, learning and growing. So every time I want to learn something new, at least know I am a bit better or more knowledgeable than I was in a certain area. Yes. So like I want to see what is new in pharmacovigilance. I'm also quite passionate about diabetes and chronic medicine, chronic illnesses. So I want to learn what is this new additional I can add to when it comes to chronic care. What is this new when I can add when it comes to even establishing new systems? Because I'm also thinking about starting, like being like in a startup, venturing into something when something is new, a new system, helping a new system come up, grow, be established, and then move on to start a new system, let it grow, come up and be established. So I'm also looking in that field. So my priority is growth. How this growth looks like is what I have not crystallized, but I am very keen on growth. I do want to advance both professionally and academically. Yes. So that is a priority, and also for just thinking of how to create for those pharmacists. My children might not necessarily want to be pharmacists, but I'd want the pharmacists who come behind me or who are behind me to find new areas. See, when we join the profession, you are in one of three places. You're either in industry, community, or hospital. Yes, my vision would be that when pharmacists leaves the school, there are like 10 places they can be. You can either, you say you're in regulatory affairs, there is clinical research, there is geriatric medicine. I'd want that they find there are not three posts that they can work in. I want them to see that there are 15 places they can go. That is, I would say that is my vision.
That's amazing. That's amazing, and I love the fact that you're looking at learning. And I'm glad to confirm that actually I've seen the learning because we are together with you in the book club K3C, and that is an ongoing engagement. Actually, I'm working on having the next host for the final session coming up soon. We'll see how that works.
That's good.
Yeah, great on that. And one thing that you've mentioned that probably could be seeding an idea that we could find areas of collaboration. On chronic care, there's a program and a project that we've been trying to think through with one of my friends, Sheila Wangeshi. I don't know if you know her. She's one of the young pharmacists. And one of the key challenges she's been asking is, for the cancer care patients, they go to hospitals, we mix their chemo products, then we administer the same and let them go home. Who offers the psychosocial support and counseling that they might need? And two, when they go home, they have a caregiver, maybe a daughter, a son, and caregiver, a nurse who has just been assigned to take care of them. How do they manage those modalities? And especially when it's a family member who has to put a pause on their life and their priorities to take care of this person, who offers the psychosocial support that they need? Those are key challenges that are still existing in that space, and there's definitely need to see how we offer that additional care, because currently it's not integrated into the care continuum that we're having for chronic diseases. So that is one solution that we're trying to figure out how it could look like. Then on the other frontier, we're asking ourselves with another lady as well, Veronica Njambi, about non-communicable diseases, especially diabetes and hypertension. How can we have this care being delivered within the community pharmacies? Because oftentimes patients will come to a hospital, they get diagnosed, they get the prescription, and it's just a matter of refilling the prescription. Do they have any additional monitoring? Do they have a referral of care, follow up with maybe a collaboration between the pharmacist and the physician who is looking at them, the endocrinologist? So those are some of the possibilities, and probably we could see, maybe we share just a brief of it. You have a look, you give your guidance, being you've been in the space, and see how that will look like as we move forward. Yeah. So thank you for that perspective as well. Great.
Yes, I'd really like to be part of that. I'd quite enjoy to be able to give whatever contribution I can to the same.
Perfect. I'll keep you in touch and coordinate the lesson and with the two guys that we're working with and see how that sits as we move along. So beyond that, as Dr. Aywak, what is success to you? And would you consider yourself successful where you are?
Well, I don't know whether I would consider myself successful. I'd say, okay, if I use the measure that I have for success, meaning that you need to be happy with what you're doing. What you're doing needs to bring you joy. So I am happy with where I am. I'm happy with what I'm doing. It actually, I feel happy. I feel satisfied. So when I go that way, I'd say yes. Am I making the millions? No. But am I satisfied? Yes, I am satisfied. So it depends on your measure of success. At least I know I've never gone hungry. I have a roof over my head. I can take myself, drive where I'm going. I can afford to actually, take a respite, take a simple holiday. So I would say, yes, I am able to take care of myself. So I am not a millionaire, but I can take care of myself and my family. And I am happy with what I am doing. I'm not miserable when it gets to Monday. I only just don't like the waking up, but I'm not miserable going to work. And I don't feel like, oh God, thank God I can leave the place. So I'm happy about the place I am in. Yes, so I have to say, if for me, that is a measure of success. And I think even when my children seem like, my son seems, he gives statements almost like, you enjoy what you do. So I'm thinking if it is visible to my children that I actually, yes, I'm having fun doing what I am doing, then for me, that is success. Yeah. So it depends. If you are looking for the money, I would say I'm not raking in the millions, but I am able to take care of what I need to take care of. Yes.
That's amazing.
And for me, if I can see, like, I'm happy, I also count success when I see somebody who I've worked with or who I've mentored is doing well. So if I've interacted with somebody and they see they're doing well, like I get very happy when I see you posting, even presenting in FIP. I'm like, that's one of our interns. So I'm very excited when I see growth in the younger people. There are a few of the other younger pharmacists who I see in different positions, and I feel very happy when I see they are head of maybe a big post in an industry or the like. So I'm very happy because I say, you do well, it will be good for you, even for your heart, if you encourage people to do well. Because the way I look at it, if you're the only person who does well, so it's almost like you're the messiah for everybody.
Yeah.
But if there are many people around you who are doing well, the time when you need help, there are many people you can talk to. Because now there are very many people who are able to stand on their own and you can approach them even for ideas, even for engaging. But if you're focused that you're the only one who is the champion in an area, you're the only master of regulatory affairs, you're the only one who knows how to get things done. When you're down, then there'll be no one who can help you carry on the work. Yes. But I'm happy if I can leave a space and there's somebody who can be able to keep that task going. It doesn't die with me. So that's for me, I would say that is success and that is joy. When I know an activity can run even when I'm not there.
You're not there. Yeah. Creating menus, getting people who can get going and move beyond it. So that's amazing. And I'm glad that you're happy with whatever you're doing. And it being that it's fulfilling for you, I hope it gets fulfilling and you get to achieve your other objectives, learning, growth in the diverse spaces that you're hoping for, and in make it move that particular way. That would be amazing. As we are coming towards the end, maybe what you could share from your vantage point, being in leadership and being at an advanced point in terms of your professional practice, what are some of the key trends that you're observing in the industry, and how can we as young professionals take advantage of these trends?
I'm noticing, like, in pharmacy, I think it pays to learn how to be multi-skilled and not just only on technical competency. Technical that your pharmacology, your pharmaceutics and the like. There's these other additional skills that can get your foot in the door. I'll give an example of this one multidisciplinary team that I joined just because of of secretariat skills. Just the thought of planning through asking a question which revolves around how an activity is planned.
Yeah.
And so you contribute your pharmacy know-how, but what got your foot in the door is that you mentioned some activities which relate to the like a planning, administrative skill. Yes. So just, I think where we are at, you need to do more than just the book knowledge that we have of pharmacy. You need to know if it's communication, have you upped your game in that? If it's in terms of being able to data collection and just other activities besides the knowing what drug should be used for malaria. Besides that, being able to talk to people, being able to engage people, being able to bring people together. And then just a number of soft skills, just being able to work with different people, build teams, try and just bring cohesion around, even conflict resolution. Just learning to see how can you best diffuse situations. Yeah. So where we are going, you need more than just a pharmacy. You need to know how you're going to work well with others and how to even utilize services, how to use digital platforms,
Yeah.
Before us, we were the ones who technology was the lecturer using printed transparencies and putting it on the projector. So PowerPoint came when we were getting closer to the end of finishing our undergraduate. So yeah, so now just being able to embrace technology and being able to utilize new tools to deliver work, and even just how communicate and engage with others, being able to work in teams, that is really key, I think, going forward.
Thank you for that. Thank you so much for that. The soft skills are very critical. And I think that is something that I've also seen in terms of even my personal practice. And events and leadership at the university level helped me gain some skills that have been very valuable in terms of my professional journey as much as possible. Yeah. If you were to start your career fresh, how would you go about it?
I definitely would have invested in the soft skills. If I was to start, when we were in campus, we used to hear that there used to be common courses called communication skills and the like, but as we didn't find those. So I think if we had those earlier on, you'd know really, it will help you get, especially now where there's no direct posting. Some of those is what gets your foot in the door. Some of those is what gets you noticed. Being able to participate in activities outside your normal schoolwork. Yeah. Yeah. And then just being able to just be brave enough to even approach those who are your seniors. I think recently there's a piece, one of the young pharmacists who came to ask about what I thought about pharmacy. So you see, when you approach somebody who's your senior, they remember a name. If somebody you have somebody to talk for you, use the word sponsor, but not in the way people have been thinking about sponsor. Not the way people think about sponsor like a sugar mommy or sugar daddy, but you need somebody who can be able to mention your name in an area where you probably would not be there. Who can be, yes, somebody who can be in the boardroom and can say, oh, okay, when you're talking about this, I know there's Dr. David Odhiambo who seems passionate about regulatory affairs. Why don't I connect the two of you? You need this person who can be able to mention your name to get you through the door. That person who can speak for you in a place where you will not be able to speak. So I'd wish if I was to start earlier, I would invest in making sure that I have a number of those people who can talk for me in a place where I cannot be able to. Like now, like I don't play golf. I don't get to a golf course. So if there's somebody who can talk about me in a golf course, and then I can be able to get an opportunity. Yes. So that's what I'm talking about. Somebody who can speak for you, who can support your vision, who can be able to sell your agenda in a space that you're not privy to. Yes.
Perfect. Thank you so much.
So if I went back, that's what I would look for.
Awesome. That's amazing. And I hope most of the young people who will be watching this will look at those possibilities and see who is the right person to speak on my behalf and how do they know me. Because I might be good at talking about you, but the question is, what am I talking about you to others?
Yeah.
That's another good one. Yeah. So the final question for the young person who is watching this, what would be your last piece of advice to them? How do they take the next step?
I'll tell them, don't be scared to start something new, and don't be scared of resistance or fight back. Just, just break down, look for something that you want to do, break it down into small manageable activities. Even if you're in a space that you currently are not feeling like you're feeling it. You might be in industry and that's the opportunity you've gotten, but it's not really what you had wanted to. Learn to be flexible and adaptable and see what is this that you really, really are passionate about, and how can you bring that slowly into that space. Because I like to think of pharmacy like a pluripotent cell. You have potential to be anything. You have potential to fit in any environment. So there's a way, if maybe your passion is in hospital pharmacy, but you're in industry, there might be something small about hospital pharmacy that you can bring to that industry that is not there. So just see, how can you break down what it is in your vision and bring a little bit so that you have some joy at the place where you are in. And then not to fear change. So if you contemplate, because I was 50-50 even when I was moving from government to KNH, because I had already been told KNH people don't move, they don't progress, you're stuck in the job group forever. So actually I joined and I was stuck in one job group for 7 years. But at least the money getting better, but I was stuck in the same job group. So my colleagues would move in terms of rank positions, but as this, the money would move, but you're still the same title, you're still pharmacist one for 7 years. So yeah, so sometimes don't be scared if you get an opportunity to get to the space that you want, and it may not be really packaged the way you wanted. Just be bold, make that move, and slowly just hope for opportunities to get to. You see, sometimes the money can follow. Get to that move so that you're in the environment that you feel like you'll best express yourself. And then now the rest will follow you with time. Just being patient, and also just being able to appreciate that we are now different generations in the profession, a whole range of so it's good to learn how do we interact, across board. What is important? Just learning what is important for a different person, and being able to connect on that level, identifying what is because you realize at the end of the day, everybody just wants to know they are heard, they are seen and heard. Yes.
Perfect. Thank you so much for that wonderful submission. And it's been a great time talking to you, learning from you. There are some of the things that I've learned from you that I never knew for the period that we worked together, but it's always a learning experience that I'm hoping we keep engaging and keep learning from you. For those who are going to watch this video, I wish you all the best. Learn from these insights that have been shared. If you need to reach out, please make contact. Let's see how we can grow the profession and grow ourselves as individuals, because the profession and the society is just as strong as the members. And the only way that that can happen is when each of us are at our best. So thank you and have a good one.
Thank you. And thank you for this opportunity. And I wish you well.